Hi everyone, welcome back. So today I'm going to be talking about another pregnancy related issue. Something, it's not always that common, but I'm going to be talking about lightning crotch, which is not a medical term, but it's just a name that's used for this type of pain. So it's basically a sudden, painful tingling, almost a bit like a pins and needles in the pelvis. And although common, it's not really thought to be serious. It's something that just happens usually towards the end of pregnancy. But once the pregnancy is complete, the problem's resolved. So unless it's accompanied by vaginal bleeding, contractions, fever or dizzy spells, it's not thought to be serious. Now, if any of you out there have suffered with irritable bowel syndrome, you might be familiar with the type of pain that I'm referring to. It's kind of like sometimes with irritable bowel, you might wake up in the morning and get this spontaneous lightning type pain or cramp sort of in your stomach. And it's sort of a similar thing to that, where it's literally this sudden pain that's so sort of severe that it can actually sort of take your breath away and stop you from moving. But it really is like lightning. It comes in short sort of spurts and then it's gone again. So while the incidence of lightning crotch, it usually is a result of the baby starting to engage in the pelvis when it's really putting a lot of weight down on the woman's crotch. While this lightning type pain is an indicator of the baby engaging, it doesn't necessarily mean that labour is starting, unless of course you've got other symptoms that are present, such as the contractions, etc. So if we look at common causes of why this happens, there are a few possible causes. So one is pelvic girdle pain. Now, this can happen as a result of stiff sort of pelvic joints during pregnancy, which will cause either a central or perineal pain. Sometimes it can be accompanied by clicking around the pelvis and hips, and the pain may also radiate down the thighs. Another cause is round ligament pain, where you get like a sharp shooting, either abdominal, hip or groin pain. Sometimes this can be accompanied by a pulling sensation, and it will usually happen around the second or third trimester. So again, it's sort of when you've got a lot of weight bearing down on that pelvis. Another cause is sciatica, which of course can be common during pregnancy. So this is where again you get shooting pain and tingling in the lower back, possibly around the hips and buttocks and down the legs. And this again is due to the growing uterus and the compression of the weight of the baby on that sciatic nerve. Other possible causes, probably not quite as common, but other possible causes of lightning crotch may include pubic bone pain, which again really happens in the third trimester, or that wonderful thing called vulvar varicose veins. Yes, you can't just get varicose veins in your legs during pregnancy, again due to the weight of the uterus compressing that blood supply around the vulval area. You can also get varicose veins there. So basically the swelling of these veins will then cause pain, heaviness and a sort of feeling of pressure around the crotch area. So really, whatever one of these things is involved in the development of lightning crotch, it almost always comes down to pressure from the weight of the baby, uterus and placenta, which is pushing down on that sort of pelvis and the groin area. Now the pain may also worsen with fetal movements, you know, if there's kicking, or as we've said, if the baby's head is starting to engage in the pelvis and really drop right down. But another cause is sort of stimulation of the nerves. So we're talking here about the nerve endings in the cervix and in the uterus, and they may be stimulated by the weight of the uterus again, and also the position of the baby sometimes, and this again will cause shooting pains and tingling. So what symptoms should you look out for? So normal symptoms tend to be very short and infrequent, and may include pain that literally takes your breath away, that makes you sort of stop in your tracks, sudden bursts of pain that would disappear as quickly as they came. You know, so we're talking about bursts of pain that maybe just last a minute or so and then they disappear again. It will be sharp shooting pain, possibly tingling, pins and needles around the vagina, rectum and pelvis. But if these shooting pains are accompanied by any other symptoms, such as a sort of feeling of pelvic pressure, severe abdominal pain, any kind of fluid leaking from the vagina, vaginal bleeding, reduced fetal movements, regular contractions, certainly at 37 weeks or under, dizziness, blurred vision, possibly vomiting, diarrhea, fever, severe headaches, or any unusual swelling in the limbs. If any of these symptoms are also present, you should seek medical attention or advice from your midwife. So in terms of treatment, you know, as we said, the only thing that will stop lightning crotch is giving birth and relieving the pressure on that pelvis. But if it returns and lasts longer than a minute, it may be worth, you know, just getting it checked as well. So the best preventive measure to try and avoid this from happening is really taking regular rest periods. You know, standing for long periods of time will only increase the pressure down on that pelvis and the chance of things like those vulvar varicose veins. But also, as much as you're taking regular rest periods, also do try to stay active sort of around those rest times. You know, maintaining a certain activity level is going to help with flexibility of the joints. It will help reduce excess weight gain, which is also going to increase the pressure around the pelvis. And also just generally thinking about how you move. You know, lightning crotch may increase if you're doing a lot of bending or twisting or lifting. So, you know, maybe if you're heavily pregnant and you've got like a toddler and you're lifting your toddler all the time, that could increase, you know, the incidence of these bursts of pain. So reducing any of these movements that again increase the pressure not only on the pelvis but also on the abdomen. This is going to help, you know, prevent these bursts of pain. Now, this is sort of another reason why, if you've seen my post on pelvic floor dysfunction, this is why even some Pilates movements for the core are not recommended if you have any issues such as pelvic floor dysfunction, you know, because of that sort of increased downward pressure on the pelvis. And so this will be the same if you are experiencing lightening crotch. You know, you might also want to avoid certain Pilates movements on the core that basically mean that you have that sustained pressure pushing down on the pelvis. Now, other things you can do, you can use a pregnancy support belt, which will basically just help to kind of lift the belly a little bit and reduce some of that pressure down on the pelvis. Swimming, you know, we've mentioned there about staying active. Swimming is fantastic, you know, for pregnancy with or without lightening crotch, because water can kind of, you know, take some of the weight off, you know, off the joints and again off the pelvis. Or also massage. Getting pregnancy massage is, you know, a great way not only to promote relaxation, but also in terms of strengthening those supporting muscles around that bump and around the pelvis and the hips, and helping to just maintain joint flexibility. But do make sure that if you're going for pregnancy massage, you must see a therapist who is experienced in pregnancy. Now, so as we've said, really just to summarise, lightening crotch will probably worsen as the baby grows and as the pregnancy advances, and certainly when that head becomes engaged. But do remember, as horrible as it is, you know, it is temporary, and as soon as you've delivered your baby, you know, these spurts of pain will go. So hopefully that's been of some help, and given you a few ideas to try and ease the symptoms if you are experiencing this. But any questions, do feel free to comment down below, or you can contact me through my Facebook or Instagram. On there as the Medical Massage Lady. And you can also check out my websites. If you're a massage therapist looking for training, go to www.medicalmassagelady.com, or for treatments or just extra information about other stuff, you can either look at my other videos on here or go to www.themedicalmassagelady.co.uk. If you drop me a message, I will answer you. Yeah, feel free to subscribe to my channel. You'll be notified when other videos come out. But for now, that's really it from me. Until next time. So take care, and I'll see you later.